if you hit view, it'll refresh.
Okay. So welcome everyone to the webinar. We're going to get started in just a couple minutes. Okay, thanks for joining us, everyone. We're going to get started in just a couple more seconds. Okay, we're going to get going. So hello, everyone, and thank you for joining us for today's webinar. Concussions are real, and so are the symptoms. Thank you again for joining us. I'll be your host, and my name is Stephanie. I am the Outreach Director at Apex Brain Centers, and I am really, really excited to be part of this session today. I'm also pleased to introduce today's speaker, Dr. Michael Trayford. Dr. Trayford is the founder and Chief Innovation Officer at Apex Brain Centers in Asheville, North Carolina. In addition to treating clients, Dr. Trayford also has a daily podcast called Train Your Brain and is an instructor at OLLI at UNC Asheville. Just a couple of housekeeping items to cover quickly before we get started. Today's webinar will be available on demand after the live session, so you'll be emailed a link a couple hours after the webinar. And also, we love to hear from you during today's presentation. So we'll be answering questions at the end of the session. So please feel free to send your questions along in the question and answer box on your screen. And last, we'd encourage you to share today's webinar with your social networks. So you can follow the conversation with the hashtag Concussions Are Real. And of course, you can post to our Facebook page. So for those of you who are just joining us, welcome to today's webinar, Concussions Are Real and So Are the Symptoms, presented by Dr. Michael Trayford. Let's get started by filling everyone in. Dr. Trayford, why did we choose this topic for today's webinar?
Well, thank you, Stephanie, and thank you, everybody, for joining us. I know we have some that are still to get in the room, so I'm going to speak to that question. Absolutely. Why did we choose this topic for our first webinar on concussion? This is something I've been dealing with for well over 15 years now, and really enjoying getting into the space of getting to folks where they're at and really trying to deliver information that really will make a difference in their lives, hopefully at some point. And why did we choose this topic? I think it chose us, and by that what I mean is whether we're getting emails or phone calls or inquiries through our website, people coming into the office, clients of ours, patients, they tell us every day that they're essentially being ignored by their friends and family, even their healthcare providers, for symptoms experienced after a head injury or a blow to the head. And this could be weeks, months, if not years. And really, this is just something that is frankly unacceptable this day and age, when healthcare has evolved so much, our understanding of the brain has evolved so much, yet we're still lacking in terms of good, solid, applicable interventions for treatment of concussion symptoms, which, as we'll see today, can really vary quite tremendously. So I appreciate you starting us out with that question. And we're just going to allow another about 30 seconds or so for others to get in the room. And while we're doing that, I just wanted to lay out some goals for this evening. We want to keep it pretty short and sweet. We want to go about an hour. So the first goal for tonight is to keep it to about an hour. And what I'm going to be doing is talking for probably about 30 minutes or so, and we're going to have a question and answer session after that for the remainder of the hour. And that's not to say you won't have access to us after. We'll talk about the ability to have contact with us after to discuss your individual cases if you'd like to do that. The next goal I'd like to talk about is being able to teach you something you didn't already know. If you can walk away with one thing from this webinar that helps push you in the right direction and helps push you towards better brain health, no matter how severe the injury and symptoms you're experiencing, then we've done our job. Finally, I'd like to really cement the understanding. And this is something, again, that folks tell us all the time. They just don't know where to turn, where to go, what to do. So we want to cement the understanding that there is hope for life after concussion, whether improvement in function, reduction in symptoms, complete recovery. There is absolute hope, and there's always a higher level of function for people to get to. And hopefully by the end of this discussion today, which is really just an introductory discussion about symptoms and some possible interventions, hopefully that will be the case where you understand that there is hope, because, in talking with people and seeing what folks are saying on various forums and social media, there is just a global lack of hope out there. And it's understandable, and I'll explain why, because, I myself am someone who has dealt with concussion over the years. I've had multiple, and I'll talk to that in just a few moments. So I'm just going to check real quick who we have in the room, and we're going to go ahead and get going with the next slide here. So concussions are real, and so are the symptoms. That's the title of today's talk. I am a board-certified chiropractic neurologist, and what is that? Subspecialties and professions exist across the board, and this is a subspecialty in the chiropractic profession where we learn neuroanatomy, neurophysiology, neuroplasticity. The applications are different than conventional neurology. The understanding is the same. The applications are different. Our applications really revolve around all types of interventions, basically anything that can be used to stimulate the nervous system, whether it's visual stimulation, sound or auditory stimulation, muscle and joint stimulation, metabolic and nutritional therapies, et cetera, things that we'll talk about as we go on, are what we utilize as our toolbox. And particularly in the concussion arena, many of these interventions can really be quite successful and are rooted quite deep in the literature. So what we're going to do is we're going to talk about just a couple of basic definitions. And this is the type of thing, we're not going necessarily deep into the mechanisms behind concussion, because a lot of people that we talk to that are dealing with concussion or looking into it for other people, they understand. And there's a lot of information out there. So we simply want to cover the goals and objectives that I just lined out. So I'm going to move forward here and just get to the simple basics and try to expand where I think it's necessary for people to understand that there is something that can be done about these conditions. So very simply, what is concussion? This is really a question that needs to be explored, and there's a lot of answers for this. My interpretation and my favorite definition is a traumatic brain injury that alters brain function, plain and simple. So you have a hit to the head, or even lack of a hit to the head, but a shaken brain, so to speak, and you have functions that change. And this is important to understand, because it's the change in function that leads to the symptoms. So symptoms are real, as we're talking about. So changes in function lead to physical, mental, emotional, metabolic abnormalities or changes in those types of abilities. So therefore, the signs and symptoms are in fact very real. For example, if you have trauma to the brainstem, or some of our more primitive brain structures, you will have problems with managing stress, anxiety, regulating vital functions like heart rate and breathing and digestion. So these things are all very real that people present with. If you have trauma in the front part of your brain, the frontal lobes, you'll have problems with attention, focus, aspects of movement, and other types of frontal lobe abilities. If you have injury to the parietal lobe in the brain, we just saw a new patient today who had a pretty nasty hit to the parietal lobe, and she has challenges with sensing her body. So we're seeing all kinds of numbness and tingling and altered sensation and ability for her brain to appreciate her body. So it makes sense where the trauma is in terms of what we see as far as symptoms go. So that said, many concussions, some are aware of this, but many are not, that many concussions occur without a loss of consciousness. This is important because it's estimated in sports even that 85% of concussions, in certain cases, certain statistical analysis, these folks do not have loss of consciousness. So that's a big misnomer, and we need to understand that a hit to the head without loss of consciousness does not, you can't possibly have a concussion. So head trauma might not be, head trauma is not necessary. So whiplash, this is a prime example. When people have a whiplash injury and the head gets shaken about on the cervical spine or the neck, that brain basically smacks around on the inside of the skull, and you have a lot of bony ridges, very sharp bony ridges on the inside of the skull that can do some damage to the brain. This is fact, it's in the literature, and we need to understand that. So multiple head traumas leading to worse outcomes. This has been brought to light by the chronic traumatic encephalopathy studies and the movie Concussion, talking about CTE and football players, but it goes beyond football players. I know plenty of people that don't play sports that have had a collection of concussions over their lifetime, and some really quite severe. So it's really important to understand that multiple traumas will lead to worse outcomes, something for another talk, because we're not talking about CTE today, but just to understand that if you have more than one, it's imperative that you get these things checked out, which leads us to the next point, that every head and neck injury should be evaluated. Whether it's a 5-mile-an-hour whiplash injury or whether it's a hit to the head where there's skull fractures and actual damage to the brain, everything needs to be evaluated. We've seen in certain cases, and prime example, we see it all the time, no two brain injuries are alike in terms of their outcomes and responses to therapies. There are similarities, but we see that folks that may have the 5-mile-an-hour fender bender accident, they have symptoms that can last a long time, the brain fog, the balance issues, all of that. And it's unrelenting, where somebody is struck by a motor vehicle at a high rate of speed with blunt head trauma, and they may have very few repercussions. It's not always the case, but we have seen that. And it's important to note that every single hit to the head should be taken seriously. So the symptoms, when people are looking at this list right here, number one, people can fit themselves into some part of this list if you in fact have concussion or know somebody that does. And this is just a sampling. This is what people tell us when we go through histories and examinations. People tell about all these things, the common headache and dizziness and coordination issues and balance problems, all the way up to digestive issues and visual disturbances and sensitivity to light and smell and irritability, getting into more cognitive changes like personality changes and trouble with academics and work. And it can go on and on and on. And there's also the greater end, where people have more severe repetitive injuries that will lead to potentially chronic traumatic encephalopathy, where people will eventually get into things like psychosis and dementia as well. But this is just a sampling. This is 25 or so symptoms that I just jotted down from things that people have told us over the years. There's a lot more, but most people can fit into some of these categories and can understand these symptoms really quite well. So what we are told, and I write what we are told, I have suffered a number of concussions in my lifetime. I chose to participate in some high-risk sports as a kid, BMX, bike riding, mountain biking, martial arts, and also had a motorcycle accident with a very severe concussion in 1995. So I have had many of these symptoms. The fortunate aspect of it is, I knew people that I could go to and help myself through these injuries as I had them. But these things do add up over time, and I have concerns for my brain safety and health and integrity over time, based on what's coming to light with these CTE studies. So all the more reason for me to keep on top of what I'm doing. But what are we told? Even myself as a healthcare practitioner, I've been told some of these things. We're told to wait and see. We're told to rest. There's nothing we can do. There's nothing you can do. Avoid lights and activity, that type of thing. Your symptoms have nothing to do with your injury. Your symptoms will go away after a while, weeks, months, a year. I've heard all kinds of numbers. Take this medication. Go see the psychiatrist or psychologist, because some people are made to feel that they're in some way crazy for having these symptoms, or that they're in fact faking the symptoms. Now, having worked with this for so long and having worked in the personal injury arena, I can see, as an experienced clinician, when people are faking things and when they're not, and there's ways to tell. And in this aspect, it's very, very, very real. Now, there's always a place. Of course, we're told to rest when rest is necessary. You had the accident, you need to rest. You need to avoid lights and places. But if a year is going by and you're still being told this advice, there's a problem. Something needs to be done about it. Take this medication. Yes, medications in certain places are absolutely necessary, but by and large, we're seeing people being given anti-anxiety medications and sleep medications and all kinds of things that aren't necessarily getting to the root of the problem. They're just helping for the short term, and then they become long-term crutches for the individual. So it's something that we need to address proactively and really be able to get in and make a difference, so we don't have to live this reality. The current paradigm. So basically what we're looking at currently, the cornerstone of concussion diagnosis, the backbone of concussion diagnosis, is sign and symptom based. That is a problem. That's a problem, because you can fill out all kinds of questionnaires and scales, and what is it? It's subjective in nature. So you're telling somebody how you feel. Now, there's a problem with this, an inherent problem, because if you're looking at a 0 to 10 scale and it's pain or balance or feeling depressed or anxious, one person's 10 on a scale of 1 to 10 is another person's 5, if you see what I'm saying, and vice versa. People experience things very differently from one another. So these types of things are really unreliable at best, but that's really all we have from an evidence-based perspective. Now, evidence-based is a double-edged sword, because we have what's out there and what's accepted, but it doesn't mean it's the best thing available. We need to move ahead. We need a new paradigm, because the paradigm that we're looking at currently does not work. MRIs, CAT scans, these things don't tell us anything about concussion, so most people are told nothing is wrong. You have the silent injury. Nothing is wrong. Nobody can see it on the tests that are available to us right now. But this needs to change, and it will change. So there are many evidence-based biomarkers of brain function that can reliably assess current and track future gains in brain performance. This is critically important. This is the basis of everything we do, and this is how we can see the turnarounds in brain health that we do with concussion. Now, everybody responds differently. We have some amazing outcomes and some slow and steady outcomes, but the bottom line is everybody's moving up a hill or up the curve. So biomarkers, what is a biomarker? A biomarker is essentially something that tells you about life. It's a marker of life. So specific to the brain, we have brain and body functions we can measure, and we can measure very accurately in most cases to see what's been injured and what can be improved upon. So you measure something, you do some type of intervention or therapy, and you measure it again. And we'll talk about those just ahead. So we're looking at the current paradigm, and I'm just shifting my slide here. Okay, so we've got biomarkers of brain function. Again, these things will tell us about the brain and how it's working. And look at the first one I have here, balance. Who has not hit their head, whether it's a severe hit to the head or whether it's a mild, that doesn't have some aspect of balance and even coordination problems after that hit to the head? One of the biggest issues of concussion is altered balance. That's because our balance system, the vestibular system, becomes injured as a result of this type of trauma. In most traumas, no matter where the head is hit, the vestibular system is almost always involved. Now, with that, you have all of these different plugs into the vestibular system, things that feed your balance, like your eyes and your postural muscles and joints, all that type of thing. So your brain needs to know where your body is at all times. And when you get a hit to the head, those things are thrown out of proportion, and they don't work so well, and the brain doesn't get good information to make responses out to the body. So this is a big deal. When people cannot experience their environments appropriately, their cognitive function will decline as well. We know this. There are, folks can Google balance and memory, balance and cognition. There is study after study after study that tells us that when we have a change in our balance or our ability to navigate our environment, we have a change in cognitive function. We lose our cognitive abilities as we lose balance. So critically important, number one biomarker right there. Other biomarkers of brain function, eye movements. We can accurately measure eye movements through testing like video nystagmography or VNG. We have cognitive function. So we're looking at now mental capacities that we can measure quite specifically. Aspects of memory, visual memory, auditory memory, attention, reaction time, on and on and on. We have all these different things we can measure. Brain waves, another thing we can measure that's really a hot topic in concussion and brain injury rehabilitation. And we're not talking standard EEG, because standard EEG is typically looking at seizure type of activity, which can be a problem, which can be a symptom of concussion and brain injury, but we're looking more at quantitative EEG or QEEG. So we're seeing, do we have too much of a certain type of brainwave that might, that might keep us fatigued, or do we have too much of a certain type of a brainwave that might keep us being obsessive and perseverating on something or playing something over and over and over again, getting stuck on things. A lot of people with concussion get stuck on things. They can't make decisions well, and they can't shift their attention very well. That has a lot to do with brainwave activity. And this type of activity can be regulated or changed in most cases. Mental timing is the next one. We can look at mental timing. This also has also been called temporal processing, the ability of the brain to essentially keep time or keep a beat, so to speak. Everything we do is based on timing, whether it's movement of a muscle, formulation of a thought. Everything is based on timing, circulation of hormones. If things don't happen at the right time, the outcomes are not good. So people will trip, or they'll have broken thoughts, or they can't make decisions. So timing is something we can measure quite accurately, and we'll see that right towards the end of the slideshow here. Autonomic functions, biomarkers like blood pressure, breathing, digestion, these are critical, particularly in folks that are having digestive issues and significant gastrointestinal distress after a concussion, which can happen and does happen quite often. We also have laboratory testing. This is blood sugar, inflammation, stress hormones, all things that are impacted when somebody has a hit to the head. And these are just a small sampling. There's literally hundreds of laboratory types of analysis that we can do. Smell, vision, other types of senses, we can measure these things. Smell we can measure particularly well, and a lot of people that have brain injury have some type of challenge with smell. And then there are therapies that can be designed to help get those functions back. Now, right at the bottom here, future tech, we do have technology that is available, but it's really not available to the general public. Things like functional MRI, positron emission tomography or PET scans, diffusion tensor imaging, which is DTI. These things can actually look at pathways and tracks and metabolic activity in the brain that really can start to tell us about parts of the brain that have been injured or aren't working well. And hopefully in the next 5 or 10 years, these will be much more accessible to us as a population, because we need this kind of information. These are functional tests and biomarkers. So this next slide, this is just a sampling of some things that can be done. And I chose pictures because we've seen enough text, and you're hearing me talk about things. But what can be done? So I have, hopefully you can see my cursor here. We have some things that can be done to help regulate autonomic nervous system function. Different types of electrical stimulation, even things like neurofeedback. We can work with brainwave regulation through neurofeedback and what we call pulsed electromagnetic frequency. And we can basically entrain the brain to become more relaxed, or to calm the fight or flight response or sympathetic response, and promote more relaxation or more parasympathetic activity. So we can measure things like blood pressure and oxygen and things in the office, oxygen perfusion, and things that will give us instant feedback as to whether we're making a difference. So with the neurofeedback, it would be more things like EEG activity. We can see real time, are we calming the brain down, or are we, kind of accelerating function where we need to? Up here, we do different types of balance and vestibular therapies. Again, balance very heavily related to cognition, our ability to think and remember. So critically important. And we can do all types of manual and computer-based exercises to help folks improve their balance. Over here, we're looking at the metabolic and nutritional aspects through supplementation and dietary modifications, through cutting out sugar in people's diets, which can be a problem with brain injury. Not completely in most cases, but really cutting down refined and processed sugars, increasing fat intake and protein intake. And everybody's different, but there are things we can do in specific cases when we find out what challenges people are having. Here we can work with the something like the interactive metronome, which is a great tool to improve mental timing and processing speed within the brain, and also accuracy of timing, which is critically important for somebody who's having balance and movement types of problems. There's also eye movement exercises that we can do based on the testing results that we have. So really a host of applications. This is just a small sampling of what we can do in office and otherwise to help people get back on track after these types of injuries. So what I'd like to do is just get into a real quick case study. I really like this case study. It's really a kind of an average sampling of what we see in our office on a consistent basis. And we're seeing concussion every single week in our office and running people through these intensive high frequency treatment programs where we're dealing with the physical, the cognitive, the metabolic, and the lifestyle factors that improve one's health. So it's not just all of those training modalities. It's also looking at things like sleep and stress management, exercise, on and on and on. Everything we can do to impact that brain, we will do. So what we're looking at here, this is a young female in her early 30s who had successive brain injuries or successive concussions. And what we're looking at here, and hopefully I'm going to direct your attention to certain areas. We don't have to be concerned with all these numbers. I just want to show you some really specific biomarkers that we were able to improve, some very subtle and some very significant, but to show you how balance and cognition or balance and memory or balance and reasoning and all of these types of things are interrelated. So this is really, really awesome here. And this is something called dynamic posturography or computerized assessment of postural stability. And what is this? This is simply a test of balance. So what I'm going to do is draw your attention to this particular area right here where the blue highlight is and it says moderately reduced. So for a young 30s female to have a stability score of 66.5%, which means that's her compared to her age and gender. So other 30 to 33-year-old females, she is at the 66.5 or 66.5th percentile, which puts her in a moderately reduced category. And that's significant for a woman who is very physically active, very cognitively active, an athlete, and one who is really an example of how people should be leading their lives. But after a couple of hits to the head, these things go downhill. So after a 10-day training period, we were able to see this gain. We went from 66 to 73%. So she went from a moderate reduction to a mild reduction in stability. Now, this is important because we see it's an improvement of 7.2%, but what it leads to in terms of cognitive function or improvements in cognitive function is really quite significant. So we had a 7.2% improvement there in her balance. Basically, that's what it comes down to. There's a lot of other numbers we can look at, but I just want to get you to that point. So this right here, and again, the numbers are a little bit blurry here, but I'm just going to call your attention to some pretty specific things. This is testing of timing, the interactive metronome that I spoke of. People are listening to a sound or looking at a visual cue, and they're matching body movements to the cue. So if they're listening to a sound, it comes at a certain frequency, just like a metronome for playing piano or another instrument. And typically we set it at about 54 beats per minute. It happens to work quite well for these types of conditions. And what happens is we can measure how consistently people time things. And we found out on this particular woman, as with many people that have had concussions, she was timing at what we call 88% hyper anticipatory, which means most of her beats or most of her hits in response to the beat were coming before the beat actually happens. Now, according to her brain, it was right on the beat, but in actuality, in reality, 88% of the time she was hitting before the beat. So 10 days later, that went to 73%. So we saw a nice reduction in that tendency, that hyper anticipatory tendency. Although not perfect, it's heading towards normal. We should see pretty much a 50-50 balance on this type of tendency. So before and after the beat, let me get my cursor here. So here and here, we should see about a 50-50 balance. So she's getting closer to that normalization, much better than 88%. Right here, her overall timing scores went from 58 milliseconds to 33 milliseconds. Now, this is basically how close she's actually responding to the beat. So milliseconds aren't a lot, but when you think about what our brain has to do in terms of reacting to situations, things happen much quicker than that. So when somebody can go from 58 to 33 milliseconds, which is actually a 43% improvement in timing for somebody who already functions at a high level, that is significant. That is helping to get somebody closer and closer to recovery. Now, for this last slide, this is really important to see, because what happens is we take into account the balance improvements. We take into account the timing improvements. There are other things that went on in terms of nutritional therapies and other types of modalities that she went through, some neurological rehabilitation and brainwave training and some eye movement exercises. But really, this is just showing a couple of biomarkers to see how we can get people from one place to the next. So with that, I'm going right to here now, something called the neurocognitive or neurocognition index. This is a marker now of 5 aspects of cognitive function. So we're looking at certain activities like what we call composite memory, psychomotor speed, reaction time, complex attention, and cognitive flexibility. Now, some big fancy words there, but it's basically our higher human functions, which are often reduced when we have a brain injury. So she was in the 73rd percentile right here. I'm going to get my cursor back here. So she was in the 73rd percentile right here when she started training, and then 10 days later was up to the 86th percentile. So there was a 13-point jump in her neurocognitive index. So over 5 tests, 13% improvement in total. The big one here is this, executive function. Now, executive function is one of the most sensitive measures of brain injury. She was in the 40th percentile, and after 10 days of training was in the 75th percentile. So a 35% jump in executive function. Now, executive function, what is it? Executive function is our ability to manage tasks, to follow instruction, to make decisions. Now, are these not some of the biggest challenges in folks that have had a brain injury, particularly concussions? These are things we hear all the time. People cannot manage their activities anymore. They're getting bogged down in the day-to-day to the point they cannot make decisions anymore. So executive function being one of the most significant markers of cognitive function, a 35% jump in 10 days is absolutely significant for this individual that can now plug back into life at a much higher level. So really, really important here. But the key is being able to measure and manage and really start to create our own evidence-based applications. And that's where we're moving in terms of research as a whole in our profession and individually through our clinic. So we're really excited about being able to share this type of information with the public, because the numbers truly speak for themselves and they line up with the improvements that the individuals experience. So what I'd like to do is I'd like to just go ahead and play a quick video, and this will kind of give you an idea of what people are experiencing before and after with these types of interventions. So I'm going to play that, and here we go. Okay, all, we're back. I'm just going to go ahead and put this back up here, the slideshow. Just bear with me one moment. Okay, so just one last slide here, and what we're going to do is we're going to take some questions in just a quick moment. Just want to bring your attention to a few things here. And number one, first and foremost, I want to thank you for joining us. This is really a short period of time, but we find we can get quite a bit of education done in short periods of time and just simply do it more often. So we do appreciate feedback and advice. And with this poll that we took here, we get to see what people are wanting to hear about in future episodes. And just wanted to draw your attention to a couple of closing points before we get into questions. And number one, first and foremost, you had met Stephanie on air there about a half an hour ago, and you can call her at 828-708-5274. And this is where you can basically set up a free consultation with one of the doctors. We like to talk with folks 10, maybe 15 minutes. Number one, to see if if there's something we can help with and find out about their situation, if it's compatible with our facility. But also, too, as we're getting people from all over the country here, we do have a number of folks travel from great distances to come here to our facility, but we can hopefully help find people near you by your location, if that's at all possible, so you can consult with us and we can hopefully point you in the right direction that way, and also answer any questions we weren't able to get to on the air. We invite you to visit us on our website. And the important thing here is if you go to apexbraincenters.com, what you can do is there's a little window that'll pop up, and there's a great 20-page ebook that you can sign up for. And it's free top 10 brain health tips. And it talks about some great aspects of socialization and hydration and all these great things you can do for your brain very inexpensively. We have also on the website a search you can do for concussion-related articles. There's a bunch of them on there, and you can search for them, and here's the actual link for it. So it's apexbraincenters.com/?s=concussion. And that's a great way just to get directly to them. If not, you can just simply go to the blog and search there. I have a free daily podcast too, which I love to do every single day. We're giving brain tidbits, brain health tips. Monday's a longer episode where we can expand on topics like we did today. And every other day of the week is simply a 5-minute tip in the area of stress management, diet, exercise, diagnostic testing, nutrition, brain hacks, as they would say, things that can help you make your brain function better. And keep an eye out for our next webinar in March. We'll look forward to your feedback and design something based on the greatest need of what we're seeing. So what I'm going to do is simply go into the chat room and look at some of the questions that folks have been asking, and really appreciate the feedback. And we have some great questions. There was a question about, and I'm just scrolling to it here. I don't have the name, but there was a question about oxygen therapy. And somebody was wondering about a lot of people are flocking to hyperbaric chambers and the like to do various types of oxygen therapy. We used to use oxygen concentrators in practice quite actively. We still have them. The challenge is what happens is we get people used to more effective oxygen, then their ability to achieve greater oxygenation rates or more efficient oxygen or breathing patterns become somewhat reduced. They essentially become reliant on the supplementary oxygen. In some cases, it's absolutely necessary, but in most cases of concussion, people can be trained to simply breathe better. I feel if anybody can do anything on their own more efficiently, that is the best way to go about it. There are times where we do need to add in things, and hyperbaric can be really important for the healing process. So yes, I do. I see the value in hyperbaric. We have sent people for hyperbaric therapies, but we really need to see what stage people are at in terms of their recovery and really what they need at that particular point. So there's no blanket answer there. It's good in some cases, but then it's also somewhat enabling in other cases. So I hope that answers the question well. And we're going to move to another question. And this is a question that is asked by pretty much everybody that walks through our doors or that we consult with. And that is, do the benefits gained through this type of training or any other type of brain rehabilitation or brain training, are these effects sustainable? Do they last? And that's an excellent, excellent question. This is something that absolutely, in many cases, in most aspects of these biomarkers, they do last. Most people think about working out a muscle. So you lift some weights and you get bigger muscles, then you stop lifting the weights and the muscles get the muscles get flabby again and they're not as strong as they used to be. Well, it's very different. When you train the ability to move your eyes, or when you train the ability to achieve better balance, what happens is your brain is constantly reinforcing these new learned patterns. So every movement you go through, every time you walk, every time you think with better brainwave activity, these things are constantly being reinforced. Now, that's not to say when people see improvements in certain areas, they're of course going to want to continue for the most part because they want to get to higher and higher levels of function. But we have had people that have completely stopped any type of home exercises or training or anything like that, and they have in fact retained a fair amount of value, if not full value. And there are some cases where we've actually seen people improve in value over time because of that constant reinforcement that the brain has by going through your daily activities. Now, if there's something happens, if people become extremely sedentary, or if they have another hit to the head, that kind of thing, then of course these things can be set back. But for the most part, these things do stick and they do last over time. Okay, I'm just going to peek for another question here. And I really appreciate all your feedback here. Let's see. Okay, there's another question about sleep. People talk about, what can they do to get better sleep? Sleep is one of the biggest challenges with concussion and with brain injury. Dysregulated sleep. So people have trouble getting to sleep. They have trouble maintaining sleep. This is a massive, massive challenge for individuals. And sleep, it turns out, is one of the most important things for somebody with a brain injury and for anybody as a whole, really. What happens during sleep is, consolidation of memories, connection of nerve cells, new material that we've learned through the day becomes learned even greater when we're sleeping. We've learned too that when you sleep, you take the garbage out of the brain. There's a process called lymphatic drainage, which kind of like getting the bad stuff out of your muscles after a workout. Through lymphatic drainage, we have this system in the brain they're calling the glymphatic system, where essentially you start to take this stuff out of the brain through various mechanisms while you're sleeping at night. So if you're not getting good sleep, your brain is not taking out the garbage. And that's critically important for a brain that's been injured and is not using fuel appropriately and is breaking things down and having a lot of waste products just kind of hanging around and creating more damage. So sleep is essential. So back to the question, what can I do to get better sleep? There are so many answers to this. The ebook I spoke of, when you go to our website that you can sign up for, there's a section on sleep. So much involved there, because what happens is people are utilizing technology in ways that doesn't allow them to sleep. They're looking at, iPads and laptop screens and iPhones and things like that right before they're going to bed, or even just a couple of hours before going to bed. And these things are generally tricking the brain into thinking that it's still daylight out. So there's applications now that can be put on phones and computers that can start to change the light of the computer. And these are good, and we use them, and we recommend them to people. Flux is one, Flux. You can search that on the internet and go ahead and get that on the computers. But the bottom line is just developing better habits, turning the phone off at 7 o'clock at night if you're going to bed at 9 or 10, because if not, you'll be going to bed at 11 or 12 or 1. And there's other aspects of sleep, televisions in the bedroom, or, pets and spouses with snoring issues, all kinds of things. But for the dysregulated brain, particularly when somebody's had a brain injury, you need to adhere to all of these really good brain hygiene tips. So the technology, the comfortable bedroom, getting making it a better sleeping environment, but also too, eating before bed is really something we shouldn't be doing a lot of. Drinking before bed as well, whether it's just regular liquid or alcohol, we need to be concerned there, because that will impact our sleep by causing us to wake up, and also the negative effects of alcohol on the brain, particularly in one who's been brain injured. So a lot to do with sleep. I could do a full seminar just on sleep. So let us know if you want us to talk about that. I'd be more than happy to do a full webinar on sleep alone. There's so much to talk about there, and our podcast covers quite a bit of that as well. So other questions. I'm going to go ahead and just look, and we have time for probably about 2 more questions. Here we go. Let's see. Essential oils. Are we using, this is from Jamie, are we using essential oils to support individuals' emotional, brain, and well-being? We absolutely do use essential oils. We talked about the sense of smell being a very important biomarker of brain function. Well, we can utilize these smell pathways or the olfactory nerve to stimulate the brain, particularly in the areas that are responsible for memory. You know, the olfactory nerve, the nerve that comes into your nose, is a direct extension of your temporal lobe of your brain, which has a lot to do with memory, among other things. So we can help stimulate and improve aspects of memory, but also brainwave regulation. We know things like lavender calm certain aspects of brainwave activity. We know other smells like peppermint can be quite invigorating for other aspects of brainwave activity. So essential oils are a tremendous addition to any brain rehabilitation or brain training regimen. So that is an absolute thumbs up with that. All right, another question. We have a bunch of them here. Is it ever, this is a great one as well. Karina, is it ever too late to improve functioning? No, absolutely not. Absolutely not. And this is the thing when I see different forums and through social media and Twitter, people talking about 5 years after, 6 years after, 10 years after. It is never too late. The longest I've seen anybody out of a brain injury was a particular man, Frank. I will never forget him, but he was 65 years out of a massive stroke. He was about 80 when I met him. He had a stroke in his early 20s, and this individual had a lot of problems walking because he had so many challenges with his eyes, and he had been through all kinds of gait training or walking therapy, as well as vestibular rehabilitation and all of that. And what happened was, I tell this story all the time, he came into the office and he had one eye that was looking straight at me and another eye that was looking completely in a different direction. It was noticeable by anyone. And what happened was, I held up a finger and I said, how many fingers do you see? And he told me more than two. So that was an indication right there that this individual needed a different type of rehabilitation. And we started very heavily on eye movement therapies with him. And within probably about 6 weeks, he did have he was using between a walker and a cane, but he wasn't using the walker anymore after a 6-week period. So there were improvements there that long, decades and decades and decades after a massive brain injury. So I say there's always room for improvement. We like to hold out hope for people, but it's realistic hope. We need to hold out realistic hope. We don't want people to assume things might happen when they might not, and that's never fair to anybody. So everything we do is based on prior experience and based on the literature. So let me just take a quick peek at the time here. We've got time. I can probably squeeze in 2 more questions. I see folks are still sticking around, so I'm sure you want the answers to the questions, and I'll try to get to as many as I can. Let's see, Rachel, when do you think that better and more reliable diagnostics such as functional MRI or diffusion tensor imaging will be more available to the public? And, I wish I had that crystal ball, and I don't understand why they are not yet. That is just so incredibly unfortunate because we have it, it's there, and we need to utilize it, but it's so incredibly expensive, and within our kind of standard traditional insurance parameters, these things are just simply not being paid for. So hopefully that will be the case. I would like to say, in 5 years or so, maybe functional MRI will become a little bit more utilized, and the PET scanning has been around for some time now. It's being used for different things, but it can tell us about metabolic activity in the brain, which is critical for concussion. So I really hope that those prices will come down. So within the next 5 years or so, we can see that. The diffusion tensor imaging is a whole different technology. It's the newest of them, and really that will probably be a much longer time before we see that. Okay, let me just go ahead and look through and find, we'll get one more question here if we have. Is there anything one can do, this is Rachel again, anything one can do themselves at home to improve attention after traumatic brain injury and concussion? There are a lot of things that can be done. The challenge is seeing what is going on in that particular brain. If there's been damage to the front part of the brain or injury to the front part of the brain that's causing these types of issues, then there are a lot of things that will help with the attention and focus. So we really need to see, number one, there has to be some type of assessment or analysis beyond the standard, questionnaires and all that will just tell us, yes, there's a problem with focus. So improving attention, we can really just start to minimize distractions. That's my number one recommendation for folks that are just looking to start the process at home. So when we're on the computer, rather than having 10 windows open or 10 tabs open in your browser, you have one open at a time, and you force yourself to do one thing at a time. And with repetition, this will happen over and over again. So your brain learns to really to pay attention to one thing at a time. It's easier said than done, because as you're doing that, you'll have a text message, or the kids will get you, or the dog, or whatever it is. But you really want to try to focus your attention as best possible, and on one thing at a time. And there's also mindful meditation, just getting in a quiet place, other aspects of relaxation too. But mindful meditation is a very simple practice that you get in a quiet place and you just simply focus on your breathing or your heart rate, and you do that for a period of time, starting at 5 minutes, then up to 10 and 15 and possibly 20 minutes. And the more you do it, the better you get at simply relaxing your fight or flight response, which will take stress off of the system that helps you control attention. So there are a lot of things that you can do, but really need to see what's going on with that brain first, and why the attention is a problem. Okay, I'm just going to look, and I am sorry we couldn't get to all of the tips here. I can get to one more question, and I'm sorry, I meant question, not tips. One more question. Let me take a peek through here. Okay, Aubrey, can you explain why we get an electrical feeling down our neck and shoulders, and what can be done about it, or what can we do to get rid of it? So a lot of people will experience sensory problems. They will go ahead and they will get numbness and tingling in all parts of the body, not just the neck and the shoulders. Usually what that indicates, there was probably some type of whiplash injury, and that it's more of a mechanical cervical spine type of problem. There can be some challenges with the nerves in the neck. Again, proper assessment is key, because there's a lot of reasons you could be getting these things. It could be a brain problem. It could be a nerve problem in the neck. So really, the appropriate assessment by a functional neurologist, one who understands the difference between structural pinched nerves and what we call functional brain problems, like the silent injuries that you see with concussion. So it's really important to see that if you've had any possibility to go to a chiropractor or a massage therapist, or somebody who can work with those muscles and see if you get any reduction in that, that's possible. If it is more of a brain problem, then, well, we'd have to look at other modalities, probably like electrical stimulation and other things, to help kind of retrain the brain to understand normal. And that's a lot of what it comes down to with folks that have had some injury to the part of their brain that senses the body, is we have to help it understand what normal is once again. And we can do that through things like electrical stimulation, vibration, and other types of modalities. So that said, I believe I'm looking at one more request here I'm trying to get to, and that looks okay. There's one more question, Sherry. What is better, SPECT scan or diffusion tensor imaging? And really, they're better for different things. The SPECT scans and all, again, looking at aspects of metabolic function. The diffusion tensor imaging is actually looking at tracts within the brain that have potentially been disrupted. So they have very different strengths. If we want to see where somebody's having, greater function from an energy production standpoint and things like that, we would look at the SPECT scan. So different things for different reasons, but that is pretty much it. We're at time here. So what I want to do is thank everyone immensely for showing up for this webinar. And this was a great inaugural webinar, and the fact that people have stuck around and asked some great questions just lets us know that this information is relevant and people want it and they need more information. So we're really looking to do things that will help feed that thirst for knowledge, because there's not a lot of information out there, and the information that is out there is really quite quite jumbled. There are a lot of different opinions, and the bottom line is these things need to be addressed, they need to be approached, and they need to stop being ignored. And that's the big problem that this community is having, is these things are being ignored and passed over, and there has to be an end to that. So we are here when you want to talk to us about these types of things. I'm more than happy to take your calls based on the phone number that I gave you there, and you can have Stephanie set that up. And until next time, we'll have an episode in March, and we're going to put your requests to good use and build something around the most popular topics. So I thank you all for joining us. Again, my name is Dr. Michael Trayford, and I hope to see you next month. Take care and have a great evening.